Hello, everyone. My name is Dr. Prasad Padwal, Chief Intensivist, Indigo Hospital, Mulund. So here we are going to demonstrate a proper ACLS protocol, assisted cardiac arrest protocol. Here there are few steps which we need to follow. Why it is important to follow the ACLS protocol? Because cardiac arrest is a situation where we have to be aggressive in the management, aggressive and basically coordinated, and immediate management has to be there because it's a question of a life of a person, and that is the only situation in ICU which where we cannot have a delay. Second, whenever we are going to have an ACLS protocol, there is a basically assessment, immediate action, and effective CPR. These are three steps we have to follow in each and every moment. With the chest compression, the airway person has to be. We have to assign a role. This is also a vital part of a CPR management and ACLS training, where basically the person, if I have to assign a person, I'll assign a person, right? So a system, basically this, please take care of the airway. That person will put oxygen for it. We'll start with a 4 liter of oxygen, right? We'll make the things ready for the intubation purpose. For the intubation, the important is that we need to keep the oxygen ambu bag ready, the laryngoscope, and basically endotracheal tube, right? If by any case we cannot secure the airway, the LMA can be used as a supraglottic airway passage. That is one thing. Second thing, during the CPR, I'll assign a second person who will basically get an access. Many times peripheral access is very difficult, so we'll take a central access like EJV, or we'll take a femoral access. Once access is done, first thing we need to take out the blood for BBG. Right, we have a machine standby in ICU where immediately we will get the blood gas analysis done. Here, basically, we can immediately check 5H and 5T, the cause of cardiac arrest. Second thing we need to reassess is the right once we get a sample, third person has to attach a basically cardiac monitor. A cardiac monitor, whenever they will be attached, they will basically ascertain right for the rhythm purpose. Once I'm done with 2 minutes of CPR, I'll basically rotate it. Four people can create a good ACLS team and for the basically for effective CPR. Right, every 2 minutes the role will be rotated. Right, then I'll ask the person to take over as a compressor. He or she will come and he will start compression. I'll go for airway. I'll basically will intubate the patient. Right. Once we are intubated, the ETCO2 reading has to be done. ETCO2 reading is very important for us because that the reading is going to tell us the basically what is effectiveness of CPR. Right. ETCO2, if it is less than 10 for the whole basically CPR, that is a very poor marker of basically recovery, as well as if it is coming as a more than 40 at any time, it's a sign of a ROS, it's end of CPR, the patient has return of circulations, right? That's basically that the basic circulation is achieved while doing the CPR, right? Every basically 2 minutes when we are checking the pulse, the pulse delay should not happen. Check delay should not happen for a more than 10 seconds. Basically, we cannot hold a CPR for more than 10 seconds. We will check the pulse. We will see the rhythm. If it is a shockable rhythm, then we will shock. In that case, there are two shockable rhythms. One is pulseless VT and one is VFib. Shock will be delivered by biphasic method. We will give it 200 joules shock, right? And immediately we'll resume CPR, right? We're not going to hold the CPR after we are after the shock. Immediately CPR has to be resumed, and adrenaline will also given by every 2 minutes. Each and every person who is giving and who is performing the role has to say loudly about what they're performing. If the person is giving adrenaline, every 2 minutes he has to give 1 milligram of adrenaline and he has to say that it is delivered. Right. Second thing, if after the two CPRs, right, after the two shocks, right, if we find that still the rhythm is not changing along with the CPR, along with the adrenaline, we have to give a Cardinal or Xylocard according to the weight corrected doses. Right. This CPR will be continued for at least 20-25 minutes till we get ROSC. Second thing, in a case of cardiac arrest, the cycle will be continued in form of chest compression, in form of basically the ventilation we have achieved through the airway, and second is IV access adrenaline.